Nick, let's start with you. UPMC has been one of the most successful and mature health systems in the country as it relates to business building, and you've had success across a really broad variety of initiatives, with two notable examples, including the spin-out of Chartwell and the joint venture that you built with Advisory Board to launch Evolent. Can you give us a brief history of UPMC Enterprises and any insights you can share on what the key drivers of success have been in enabling you to scale and build new businesses?
Sure, and appreciate the opportunity to talk about our journey at UPMC. I think, it goes back many decades at UPMC really as an organization that's had an extremely high level of risk tolerance and a willingness to sort of push the envelope. And so, we think about the building of a multi-hospital health system that about 25, 30 years ago said, we're going to start our own health plan. And it's actually the largest source of revenue for the organization today. So it outsizes our provider side. And so, you think about that type of entrepreneurial mentality and ethos in the organization. About 10 years ago, we brought a lot of the different entrepreneurial pockets within the system together under one roof and called it Enterprises. And it really started as a digital health initiative, but has also evolved into including life sciences as we've tapped into the incredible research engine that is inherent within the University of Pittsburgh, our partner, as well as within our clinicians who are often wearing two hats, both as a professor of medicine as well as a practicing clinician. And so, as an organization, we've thought about how to capture that under a single umbrella and put kind of the right dedicated resources around it, and it's been a big driver of our success.
So let's move to some case studies, starting with Chartwell. What was the opportunity you all saw in the home infusion and specialty pharmacy space, and how did that lead to the spin out of Chartwell to CarePath RX?
Sure. So UPMC had built Chartwell over the course of a long period of time into a very large specialty and home infusion pharmacy serving UPMC's patients, both and members, really, from a health plan perspective as well. And we found that integrating that pharmacy effort with our clinical efforts was generating much better results. And so our clinicians liked it, referred to it, and ultimately it was part of our obviously our specialty pharmacy network from a payer perspective. And so we were getting really good results there, but we looked at it and said, are there ways to amplify what we're doing and kind of get to a next level with a partner? And also the way that UPMC has thought about it, especially as you think about our international operations, is how do we take what we do well and export that and help others learn? And so we created an MSO and then divested that MSO, rolled some equity, so we've continued to participate in the upside of that organization. And we've been able to achieve some new things, enhanced payer relationships beyond UPMC, access to additional limited distribution drugs, as well as additional partners in sales that kind of got beyond where we could get as an organization, keeping everything in-house. And so we've continued to own Chartwell, but we have a productive management relationship with CarePath, and we've brought some new folks with more national presence to the table and taken the team that really built and understood how to work with a health system to scale something and help them interact with other health systems to grow.
So partnerships with complementary organizations have also been a huge element of your overall business building philosophy. Can you tell us more about the genesis of the partnership with Advisory Board to build Evolent and what the key drivers of success in making that relationship so successful were?
Sure. So I think when we talk about Evolent, and I started off by talking about our effort to build our own health plan over the course of many decades, and I think that when you think about what the Advisory Board brought to the table, it was really defining up front, what does UPMC know? We know how to build this ourselves. We think that this can be transferred to other systems, but what we need is a partner that knows how to interact with those other systems and sell. And Advisory Board is in the business of consulting with health systems, right? So certainly there's a big part of that made a successful combination. UPMC had the infrastructure, the technology, and that know-how, but kind of defining up front sort of what are the things that you bring to the table, understanding maybe where your limitations are or where areas that you can complement with a partner, critical, and then also upfront defining accountabilities, right? Understanding, what are the expectations for each of those parties bringing to the table, not just, a brand or an umbrella, but really kind of how do you define accountabilities, how do you set strategy and set specific milestones and targets, and know when to bring in a partner. In that instance, we also eventually brought in a capital partner before the IPO of that business.
So there's a lot of different structures that health systems can employ as they're thinking about their for-profit activities. We have examples like FEBI, where the mandate to invest in partners sits with the Chief Innovation and Strategy Officer. You see venture arms in many cases, organizations like Enterprises and Northwell Holdings that are fully contained units for for-profit activities. What advice or key lessons learned would you give to those who are thinking about the best way to set up their for-profit activities?
So I think on one element of it for sure is to understand your ultimate goal. And I think at times, revenue generation and operating profit generation are one thing. If you're chasing liquidity events, those can oftentimes be a different activity or trade-offs. Sometimes as you build up the revenue and the operating profit, you have an opportunity to sell off some of that for a liquidity event, but you have to understand what are you leaving behind in terms of potentially a hole in the P&L. So there's elements of that, I think, understanding the timelines and the expectations around when you're going to generate liquidity, especially as we think about starting businesses. That's a 7 to 10 year journey. Obviously, everybody's today is going to talk about where you have the ones that don't turn out the way that you would expect, and so they're not all going to be the 10x return type opportunity. You're going to have some great outcomes. You're going to work really hard to have some okay outcomes and return your capital, or maybe do a little better. And you may work even harder to lose on some of these. And so, understanding the distribution of those outcomes. And then we've really had success in creating a unit that had dedicated management, leadership, and time and capacity to really work on these things, but having really strong ties back into the clinical and operating nature of the business. And so we tie an operating champion to the investments that we're making to make sure that we have some of their time and buy-in. My colleague Aman is here, right, who sits within the leadership of our provider side of the house as well. And so he spends a portion of his time with us every week, really helping to make sure that anything that's on our clinical side is is meeting the needs, and that it's getting the proper attention on the other side as well.
Nick, thanks so much. Olivia, unlike UPMC, which has taken sort of a mixed hybrid approach to business building, you've all really focused and concentrated on businesses that are wholly owned subsidiaries, 100% built by you, have been really successful. You've done it in real world data monetization with Nash Bio, DME with CareFluent Connect, pharmacy with RX Solutions, GPO with the Vanderbilt Health Purchasing Collective. Can you start by telling us what are some of the strategic factors that you all weigh as it relates to whether or not to build these fully yourself versus partnering, and how have you considered partnerships and bringing others into some of these initiatives?
Yes, thank you. I'd say we're early in our journey. We launched our division about 5 years ago, being that for-profit arm of the organization. And like you said, we are really focused on developing our own internal assets, productizing those and bringing them to the market in areas where we feel we do have competitive advantage, mainly around other health systems who tend to come and visit and say, hey, I'm really interested in how you guys set up your specialty pharmacy. A lot of it has been an inbound approach, but we certainly do our diligence, our market assessments, and really look for the right opportunities if we're going to make investments on behalf of the medical center. Our company portfolio today is doing really well strategically, and I'll just say many customers are here in the audience today. We've worked with many of your organizations, which has certainly been a privilege, but I'd like to see us continue this journey, really expand our footprint into other models like UPMC and elsewhere. Say, while we can continue to grow and build our own companies, I think that is one strategy, and it's been phenomenal. There's certainly many levers we can pull in terms of our diversification, even within our for-profit portfolio. And the last thing I wanted to say on that is, while it's a privilege to work with so many health systems across the country, which has been an incredible journey, we'd love to work with you all more on actually commercializing those types of assets together. I think our reach and scale could be really incredible.
Let's jump into some case studies, starting with Nash Bio, which has been a huge success. A lot of health systems have really struggled with real-world data monetization, but you've driven both international and domestic growth in that business across a lot of different vectors. What was the big opportunity that you saw in pursuing that initiative, and how has the project played out since launch?
Yes, Nash Bio, and can't have a favorite child in the portfolio, but we do. Nash Bio is an incredible business. Vanderbilt was well positioned in that space. We have one of the largest biobanks in the world, right? So we were already sitting on an asset of incredible value in terms of genomic data. We are also the first to go live with the electronic health record, which meant we had the longest longitudinal records of phenomic data. So Nash Bio matches genomic data with phenomic data and brings those valuable data insights back to typically big pharma as their buyers or purchasers to accelerate drug discovery, maybe different uses of drugs. But now they've really, I think that was kind of level one. Now they've really migrated into other types of the phenomic data on the medical record, including non-discrete data, images, like radiological images, lab results, and also what they're calling wave data, which is more EKG information. So now we're really getting that holistic patient view with the intent of, right, improving patient care.
Let's transition to specialty pharmacy, where you've also been a leader and a pioneer. Specialty pharmacy for Vanderbilt, like many of the health systems in the room, is incredibly important, a huge driver of your overall margin as a health system. How have you considered scaling up and externally monetizing that asset? And to what extent has 340B created complexity in any pathways you've considered to do that?
340B is something we monitor closely, probably like many of your health systems, and we're all curious, right, making bets and predictions about where that's going and how it's changing. But at the end of the day, for us, it really is about the patient care and outcomes. So we continue to focus on that. I was very fortunate about 12 or so years ago to be boots on the ground building Vanderbilt Specialty Pharmacy, and now have worked with dozens of health systems across the country building their programs. But a key part of it is focusing on the patient outcome piece. While the financials can certainly provide incredible upside for an organization, we've built an outcomes and research team just in the specialty pharmacy to prove that our care model is better than any other care model that exists. And so that's where the value and the inspiration for our team comes from, is knowing, yes, we're generating money, and that is wonderful, and it's sustaining the medical center. We are, more importantly, improving the outcomes of patients. And while 340B levers and things may change, the fact that we can provide the very best quality patient care will endure.
So last case study before we finish up with Nicole. You've scaled your GPO, the Vanderbilt Health Purchasing Collective, national. It's now in 48 states, has been a huge success. What was the growth pathway like from a GPO for just you to a regional one to a national one? And what's led to the success of that program?
Yeah, good call. So, internally it was fairly simple. We were able to negotiate better contracts and some direct-to-manufacturer contracts better than we were able to do through our kind of GPO platform. We ended up expanding that as we realized there was a market opportunity. Many health systems were, I'd say, not pleased with the experience they were having with some of the larger GPOs, and there was an opportunity to bring in more of a concierge-level white glove service that was really focused on the health system's experience and focused on what the health systems really wanted. The plus side to that is our pricing has been better. We have been able to negotiate better pricing, and so when we're talking to other health systems, we're able to outcompete anybody else in terms of price, but it is that service level and a health system helping a health system feel that I think has allowed us to continue to grow and expand. And as we grow, right, then we have more purchasing power, and so it becomes this wonderful positive cycle where we've been able to expand 48 of 50 states at this point.
Amazing. Thanks so much, Olivia. And transitioning to you, Nicole, IU has had an amazing growth story, has been able to generate tremendous financial performance in the last couple of years. You've done that through both organic and inorganic growth, and you've also had a lot of success in the development of homegrown solutions that can service regional demand. Can you share more about your overall philosophy to growth and to business building, and how you've thought about taking solutions that you've developed internally to service regional demand?
Yeah, it's funny that we arrayed this way, because I would say we are probably earliest on our journey in terms of building businesses, and we certainly have some lessons learned already. So we started as the merger of 3 hospitals in downtown Indianapolis. We have spread now, we're 15 hospitals, about $8.6 billion in revenue, and the only academic health system in the state. So we're uniquely positioned from that perspective, but most of our growth historically has been in very traditional realms. We're continuing to kind of build out the full continuum of care. We had at one point the largest hospital at home program during COVID. The census has come way down, as it has for many since then. We have a full array of post-acute services. And with DME, we saw an opportunity in a couple of areas, enteral nutrition and infusion, where the margin's actually quite good, at least in Indiana. And we saw an opportunity to really meet the needs of our patients more fully, including our pediatric population, but also to drive higher margins.
Tell us more about the DME opportunity. We've been incredibly impressed with what you've been able to build there. What originally motivated you to launch it, and how do you think about the impact of DME on the entire health system? Any metrics or ROI that you can share for us would be very helpful.
Sure, yeah. The motivating factor for launching the DME program was really just an interest in more fully serving the needs of our patients. Particularly at Riley, our children's hospital, there's a lot of complex need there. But we did build out a solution to service our entire population. We are also beginning to actually sell that to other health systems in Indiana, and we're beginning to think about, as we're exploring sort of the neighboring Midwestern states, opportunities for expansion. We have had at least one conversation with Aegis about perhaps a nationally scaled play. I will say we're very thoughtful about where we go into the DME business, so we are focused on those areas where there is a positive margin. We tend to partner for a lot of the rest of it. But that said, there probably still is a play. It's actually amazing to me how many calls and emails I've gotten about our DME program from folks across the country. I don't know where the visibility is coming from, but we appreciate it. So as we think about it, it's really, again, meeting the patient needs, it's the rate of growth, and then we also do look at the ROI. Our margins on this business are considerably higher than our core business. They're 20 to 30%.
There's a tremendous amount of interest in DME across the consortium, but it's a very broad bucket, as we all know, that can take a lot of different forms and cover different categories, from mobility devices, CGM, CPAP, home infusions, and more. How do you all think about what categories to prioritize as you build DME, and how have you gone about it at IU?
We do think there's a lot of opportunity for RPM and for that technology. We think it also supports our broader strategy. As you know, every state in the country is facing an aging population. It's particularly marked in Indiana. So we're looking at a growth in the over 65 population that far exceeds the rest of the population, which is essentially flat. And unless we start delivering care differently, we're going to really crowd out surgical admissions from all the Medicare medical admissions and longer stays. And so we're trying to figure out, how do you innovate in that space? That is actually one of our major areas for focus. 2 areas. One is the shift in care locations, which was referenced earlier. And the second is, how do we anticipate the needs of that population going forward? So we do think that there's an opportunity for tech as part of the strategy.
We are just out of time. Such a fascinating discussion. I hope this has left everyone with some interesting case studies that you can think about emulating at your institutions back home. Please join me in thanking Nick, Olivia, and Nicole.